Okay, so I'm so glad to have a wonderful, beautiful lady all the way from Calabar in Nigeria and part of the uh, diabetic retinopathy team. And her name is Bessie. But I'm going to let you, Bessie, introduce yourself. Just say who you are before we get into our interview today.
Okay, so good to see you.
So good to see
Um,
you too.
my name is Bessie George. I am on the diabetic retinopathy screening program here in Nigeria, in Calabar specifically.
Mhm.
I'm in charge of the registry. I'm the one who registers every patient on board the screening program. I am an administrative staff of the hospital because I work here in the teaching hospital also, where we
Yeah.
have the diabetic clinic.
So, let's have a sort of a primer, I would say, about your involvement in the administration side. I mean, how long have you been doing admin, just generally anyway? How many years have you been in that side? Is that the area that you specialize in or something else?
Yes, actually, I studied, let me come to the basics. I studied economics. So when I got into the hospital, I, I was posted to the monitoring and evaluation units. So I've always had trainings in monitoring and evaluation, more of data management.
Mm.
I have been on the HIV program here in the hospital when we started it. Yes. Up until when Dr. Dennis told me about that. I've been there on that program for over 5, 6 years.
Mm.
Yes, doing M&E. I've been trained on M&E protocols and procedures about all these research programs. So when Dr. Dennis told me about the diabetic retinopathy, it was really interesting to
Mm.
know that even I as a person didn't know diabetes affects the eye to that extent.
Well, wow. Yeah,
We
yeah,
always know diabetes about the sugar part,
yeah,
and
yeah.
then maybe if somebody has leg ulcers or
Agitation, yeah,
yes.
yeah,
So that's that's the more that's when that's a part of diabetes that comes to the eye, as in like that's what people really know about. So
yeah,
when he told me about the eye part, I told him, sir, that is really interesting. I didn't know that
yeah,
this kind of thing
yeah.
exists. So he told me as at that time, he was looking for someone to manage the registry. I told him I would like to be on board.
Mm.
And let me use his words. he said, he said, when you were in the HIV program, you used to go for trainings, you used to have some stipend,
Mhm.
something added to yourself. But if you're coming here, it is just a free thing we are going to do. Nothing financial added to him. So
Yeah.
in my words, I told him, I think it's time to pay my dues. I've also enjoyed, so let me put in my
Wow.
small work.
Wow. And that's amazing because, he was upfront with you and said, this is a free program and, the
Yeah.
funds and so forth. I'm sure he's very upfront, Professor Dennis is, and you still wanted to do that. And that says a lot about the team and those that we've been interviewing about their reasons for coming on and doing this to help people, reduce the blindness or at least, vision impairment in people who are living with diabetes. So coming back to, your role now and how important it is to the program. And so just let us know how many patients are actually registered on the program and how do they actually get onto the program, first of all? How do they get registered on there? So those two things, how many have you got on there? And then how do you actually get them onto the register?
Okay, for Calabar, we have on the program well over 3,000, about 3,500 plus patients on the program that has come for the first time to our
Yeah.
screening program. And out of this, we have also screened 2,500 and something, as in all, a greater part of them have been screened. But
Mm,
how do they get to the program?
mm,
They come to us to the diabetic retinopathy. You know, we have Calabar has a center, so to
Mm.
say, for the diabetic clinic, and which every patient that is diabetic knows that center. It was actually donated by the Lions Club
Yeah.
that partners with the hospital. So everybody knows that building in the hospital. So many patients who have tested, and known, oh, they have high sugar, some of them don't come to our hospital to access treatment. But because they've heard of that center, they come there. So they come by self, and we get them on the program for screening. Some
Mm.
of them come as a result of referrals from the endocrinologist now, from the sugar doctors. They come there to us for the diabetic retinopathy screening. Some of them come to the screening program through the outreach. We have been doing outreaches, to
Mm.
different hospitals, which we also still want to do by next year in earnest. So
Mm.
some hospitals, we only give them a letter, they get back to us when they have, given appointments to many of their diabetic patients. We go there for the screening, and that's how we get some of them on
Mm.
board our. And
Mm.
some of them also come to us when intermittently we do a public announcement. We do on radio. There's some of the doctors, the ophthalmologists go on TV or radio to talk about this program and sensitize the public about it, so that that's how people trace us. There was a time we did a conference, we involved the consolidation, more like, we involved the community pharmacists and the lab people in the communities. And then we also sent letters to churches. So people know about this program and just come. They
Mm.
don't necessarily have to be referred from the hospital here to us. So that's how
Mm.
they.
That sounds interesting. How, yeah.
Unfortunately,
Sorry, what
I'm
was
afraid
that?
that we still don't have as much as we want. And that's why we still
Yes.
intend to go on with the outreaches. Yes.
Yes. So, I mean, that's interesting, Bessie, because there's so many different strands that you're using. You're not just relying on one way to reach people. So, in terms of how many people you need to reach, what's the figure do you have approximately? You might not know the specific figure of how many diabetics that you need to reach.
Yeah,
Right.
that's more like when I saw when you said, okay, let me say what we mean by our goal for the program, because when Dr. Dennis brought me on board, that was what he told me. He said, Bessie, we must get over 9,000 people as at
Right.
that was, I think the statistics is about either 2015 or 2017, thereabout, that they have over 9,000 people in Cross River State that are living with diabetes. And so we must have and strategize, have a way of reaching these people and
Yeah.
bringing them on board.
Yeah.
So you see, I still have a lot of work to get many of them on board.
Yes, yes, there's at least 6,000 more to go, isn't there? You've got 3,000 on your register, 2,000 roughly that have come on the
Yes,
screening,
yeah.
roughly. So it's still even working with the 1,000 or so that are not coming to screening, plus the 6,000 that are still out there not knowing about the diabetic retinopathy clinic. That is free. It's absolutely free. Free, free, free. But so I can understand why you've done, or the team have worked hard, because it's quite a tightly knit team. There's a handful of you, and
Yes.
so you seem to have done pretty well to at least start to touch different areas of the community, different strands of organizations that would have some kind of connection with the diabetes, people with diabetes. So, okay, so I'm really excited about this, because at least, it started to move a little bit. So what do you think it's going to take to build that register? Do you think it's going to be more of one thing? Because you've done quite a lot. So which ones were effective to help sort of guide that answer? So what do you think it's going to take in terms of building the register now?
I think we've had that discussion just amongst ourselves in-house recently. I think it has to be more of us reaching out. You know, the concept of this city and state and the mentality of the people comes to play. So many people have the impression if I go to the hospital, it will be everything in the hospital is expensive. If
Mm,
I get there, and they
mm,
will also waste my time, you know, because
mm,
of the procedure, they have to pass through this place to, and then so some people just believe to do self-medication is better.
yeah.
That's why we have to involve those community pharmacies because people go to them just buy drugs off the counter without knowing about diabetic retinopathy. So I think we still have to do more in
Mm,
terms of outreach, yes, because we can't also just depend on the patients that come to us in the hospital.
mm,
Yeah,
mm.
we have seen several of them that we have had to screen. You know, come back for a yearly screening, come back for 6 month appointment. You know, so but the number of because I'm looking at the statistics part, the percentage of the people that are new as in fresh new people that don't know ahead are just coming or maybe have just been diagnosed or had been diagnosed and just coming to the hospital for the first time is not high enough, you know,
Mm,
for us to meet these target people. So
mm.
we have made plans to intensify outreach programs.
Right, I'm with you. So that's from the statistics that you're seeing, it really warrants the outreach program to be pushed forward. So that was my question, really. I was going to ask that about how are the stats going to now use help the program to move forward. So the outreach is one of the biggest drives at the moment, I gather. That's wonderful. So are there, how would you see or how would you determine the funds that we're trying to raise? Because obviously here it's in the UK, we're really wanting to help you and to let this be a reality for thousands and thousands of people in Calabar and in Lagos. How would the money help towards increasing the stats?
Oh, it will help. It will help a great deal. You know, thank God we have the fundus camera, which can also be moved around.
Yeah.
And we also have the handheld, which is even more mobile,
Yes.
you know. So it is now, the funds is going to help us in reaching out because there was a time, I remember, I think sometime last year, when we were doing outreach, we were sending letters to these primary health centers, to all those other places. Then one lady picked that letter through a primary health center and called because we have a number of the program manager or somebody on her and called that she would like us to come to Ugep and Ugep and Ugoja.
Mhm.
And these are two different local governments. And I tell you,
Wow.
one of them takes up to 6 hours from Calabar main town
6 hours.
on
Wow.
6 hours drive. And she said they have so many patients there. So many patients there that are diabetic. And in fact, some of them have lost vision already,
Oh,
because of, and then, that's what I said, the mentality of the people. Some of them feel is witchcraft attacked. Some
mm,
of them feel, but she, being that she's a nurse and she works in the health center, she says she knows that it's due to the
diabetes.
diabetes they've had. Yes, that is that. Please, we should try and come. And that period we didn't have even this handheld for those cameras.
So
We
much
did
less.
the slit lamp and the ones we had, the camera, the fundus we had in the hospital, which later wasn't functioning too well. So we were
Yeah.
just helpless with her. When we had this meeting, we were saying, now if we have enough funds, we can move the team, even if not everybody on the team. You pick the key people on the team, move with this machine. Only that we will have to get her informed, arrange a date that we will come, and which means some people will have to sleep over at a place and then continue maybe
Yes.
the journey back home tomorrow the next day. So funds are really necessary
Mm,
Yes, funds are really, is going to
yeah,
really go a long way in reaching, should
yeah,
I say, nooks and crannies. It's going to go a long way.
yes, yes. I can see that, Bessie, because just the back part of any kind of project, you've got to look at your overheads, how you're going to be able to mobilize yourself to get somewhere. And that costs funds. That it's going to take funds to actually bring a team over to 6 hours away to people who need it. And so you need everything at your disposal, really, don't you?
Yeah.
So yeah, I think that'd be great. And then so having the mobile, which you have already, the
Yeah.
mobile fundus camera, and you're able to go to a remote area, a city like that. And then so now having, I suppose what I'm hearing is that having the equipment that you need, having the resources that you have, you're able to respond quicker to
Yes.
requests.
Yes.
Yeah, because people would respond. So it's no point us, I suppose, going out there and telling people you exist if the resources
We
can't
can reach
handle
up. Yes.
6,000 more people.
Yeah.
Yeah, yeah, yeah.
And
Wonderful.
some of them will be farmers, some of them will be, artisans, people who may not be able to bring themselves. They too are going to look at the cost on them to come to the hospital that is providing this service. So that's why we now said, for us to do the outreach, for us to succeed on this program, we have to take the services to the people.
Yes, yes, because 6 hours is a very, very long time to be traveling. I think so for a patient to be traveling that long, it's just incredible. So yes, I totally agree. The outreach, as we've mentioned with John, and we definitely want to showcase the outreach program here. Will do a lot, it seems. So we need that help from those who are listening. So what would you say to anyone who is listening now about, they've heard the stats, they've heard what Caliber's trying to do and stuff. So what would you say to anyone who is listening and they want to bring, they want to contribute in some way? What would be something that you would want to say to them?
Okay, I would like to say that everyone and anyone who is moved and who has the heart to help eliminate and also reduce the cause of avoidable blindness, please should help us. Yes, let us reach out to these people. It's what we are doing is a way of helping the patients too to reduce the burden of diabetic management. Diabetes itself is expensive to manage in some clients, especially in this part of the world. And so if we have this support and this fund, it will really help, these patients, because if we are taking off the load of the eye care and the eye, treatments from them, at least it will go a long way in helping the patients.
Yes.
And the
Yeah.
funds will also, yeah,
Mm.
help in us reaching, as just like I said, all the places that are needing this care. We could just be in our hospital here and not knowing that several people miles away or in fact, a greater number than we have seen here are somewhere, that
Mm.
need this care. So we really need these funds. And everyone that can help should please support the funds.
Yeah.
Thank you.
Yes. Thank you. Thank you so much, Bessie. And you've really outlined some key things about it's avoidable. This type of blindness can be avoided. And, that many people don't know that. And we want to go out there. You want to go out there. You're willing to sacrifice your time, which you are doing, volunteering your time and effort to be able to reach out to others. So thank you so much, Bessie, for your time. And, we're anticipating great things to come. And we, want to showcase this, I should say, here on our platform. So thank you so much indeed.
Thank you too. Thank you, Adele, for the good work you're
You're
doing. Thank
welcome. You're welcome. It's such a pleasure. Such a pleasure.